everyone, my name is Megan.
And my name is Colleen.
And we are going to be discussing about the Beers criteria, which is polypharmacy. So I'm going to be talking about why it is important, as well as the knowledge of the Beers or polypharmacy, and apply it to the nursing practice. So why is it important? It's an important topic because as nurses, or student nurses, we are learning what to watch out for in our patients. And one of our many jobs as a nurse is to promote patient health and safety, as well as to get them to the best optimal health status before they go home from the hospital. So it's just really good just to be aware of it and just to be consciously thinking of it. And so some knowledge that of the Beers criteria and polypharmacy in general that can be applied to the nursing practice, is knowing the drug-to-drug interactions of all of the medications and knowing which drugs to avoid in order to not cause any adverse reactions in our patients. When it comes to geriatrics, most of them are on a lot of medication, so we have to look at the Beers list and avoid any of the contraindications of the medications on those lists. And we also need to be aware of the vital signs and lab values of the medications and make sure that we are closely watching them.
Okay, there's a direct correlation between the age of the patient and the number of prescriptions taken daily. Older adults are more likely to have multiple prescribers, and on average, they're on 7 different medications daily. 19%, the major complications in the hospital are medication-related, and some risks for polypharmacy. Who's at risk are older adults and people with chronic diseases such as coronary artery disease, diabetes, COPD. And some of the risks of polypharmacy are medication interactions, compliance, depression, confusion, immobility, falls, sedation, hospitalizations, adverse drug events such as confusion, loss of balance, falls, and even death. And some of the medications that you need to watch out for with older adults are over-the-counter medications such as antihistamines, because they can cause blurred vision, constipation, confusion, anxiety and insomnia medications that they increase the risk of falls in older adults. Anticholinergic drugs, they can cause constipation, confusion, and urinary problems. NSAIDs, long-lasting NSAIDs, increase the risks of indigestion, ulcers, and bleeding, so there's GI risks. But the short-acting NSAIDs are safe with older adults. Digoxin doses increased more than 0.125 milligrams. It can be toxic because kidneys don't work as well in older adults. Certain diabetes drugs, such as glyceride, can cause a decrease in blood sugar. Muscle relaxants increase risk for falls, and Demerol can increase seizures in older adults. I know sometimes as a medication passer, when I have to stay over on a night shift and pass medications in the morning, it can be very confusing for me because a lot of times many of the medications have been DC'd or changed, and you really have to have a lot of knowledge and which ones have been discontinued, and if the dose is correct, and if there's no errors, and what interactions, you know, to prevent any adverse reactions or serious complications. So if it's confusing for me, who's been a medication passer for 10 years, I can imagine how confusing it would be for older adults that live at home and don't know much about medications.
All right, thank you.
Thank you.